Hey guys, Dr. Aaron Wall here with Gateway Chiropractic in Fort Worth, Texas. Want to make this video with you. Those of you that are dealing with bad posture, that doesn't have to be your destiny. Maybe this is your spouse or even your kids. We're finding that bad posture is happening earlier and earlier in life with patients and their family and friends. One of the reasons is we're all hunched over like computers and tablets and iPhones or smartphones and playing video games. A lot of the kids are doing that so early in life that it creates these really bad posture abnormalities earlier than you would typically see that. But these are big problems because posture has a lot more to do with our overall health than it does with just the way we look. But obviously posture is a window to your health. So I want to elaborate a little bit on that and also explain how our practice corrects bad posture. So that doesn't, again, have to be your destiny. We can see some amazing change in bringing you back to what normal should look like. But the reality is when we see these postural abnormalities, we might think they're normal. They're not. I have a couple of videos. One of them is how you can identify if you have bad posture. There's another one that's explaining good posture, but just kind of a summary of that. If our posture is off, then the biggest problem with that is not just the look of it. The problem is what's going on inside your body when your posture is off and it's stuck that way. Your posture is really regulated by the strength of your spine and the spinal column and all these muscles that surround it. So if you're in good posture, if you have level shoulders, if your head's over your sternum, if your head's back on your shoulders, your hips are in good alignment, your spine's going to be straight up and down from the front. That's how we're designed. Hips should be level. From the side, we need to have curves in our spine. We need to have a curve in our neck, curve in our lower back. When we have these bends, the nerves that come out of the spinal bones, they're protected, they're surrounded, they're not getting squeezed or stretched or damaged in any way. Now, these nerves are vital. They don't just control muscles. A lot of people think if you have a head that's in front of your shoulders, if your shoulders have rounded, that is a sign that you have lost the curve in the neck. Your spine it's misaligned, it's subluxated, and now it's stuck like this. Nerves get compressed, the spinal cord can get stretched, and these nerves, that's not just going to cause pain. People think that. This can cause a variety of problems. These nerves don't just go to muscles, they go to the extremities, they go to your arms and legs, they go to a lot of organs, such as like your lungs and your heart, and you can kind of see different nerves run different organs as you go down the body. So there's a lot of times when a patient comes into our office and they have really bad posture, they might be having pain, that's what brought them in. We start digging into like the history and what they've been dealing with along with that pain. It's like headaches, thyroid issues, numbness in the arms and hands. They're getting sick a lot. Well, these nerves regulate organs too. So when they are damaged due to bad posture, it can create problems with organs, not just with muscles and pain. So that's kind of one of the big problems that I want to address in this video. The other big thing too is how does this get degraded over time? Very simple. We are creatures of habit and we do repetitive stress. So the way we work at a desk, everybody's at an office desk these days on a computer hunched over. The way we sleep, the way we exercise. Maybe we played sports in the past, we've had traumas from that. Maybe it's the way we walk from an injury. There's so many things, are auto accidents. There's a million ways, I guess, that our posture, our spine can become misaligned and our posture will form to that. And if we don't do anything to correct it, gravity just kind of pulls us down and you start to see these really bad posture abnormalities with people walking around. And maybe that's you. Maybe you looked in the mirror and it just doesn't look normal to you. I would imagine that there's some other symptoms going along in your life that goes along with that bad posture. So again, hopefully that made a little bit of sense with you on how you can identify that. Watch our other videos as well, that helps. But also, how does our office correct people with bad posture? Well, obviously, first thing is you got to make an appointment. We have a little click your schedule link. If you're watching this video, you can find a day and time that works really good to get you in the office, get you plugged in. But obviously we're going to do a detailed history because typically with bad posture and people that have a lot of pain, there's other stuff going on that they don't realize is related to their posture, such as their headaches or their dizziness. Maybe it's their vertigo, maybe it's their breathing challenges, maybe it's digestion. There's a laundry list of things that can be accompanied by bad posture over a long time. We want to see everything that's going on with somebody with their history. So we fill that out. We come back into this area. This is our exam room. We'll do a detailed examination. We do thermography. When the posture's off and these nerves are getting damaged, they get really inflamed. We do a thermal scan that can detect where those areas are. Then obviously we do structural x-rays for posture. They're posture x-rays. We are checking to see what is normal. If your spine is bad posture, we want to find that out. That way, based on your x-rays and your exam findings, we can start to adjust the patient and do specific muscle rehab exercises to build up these imbalances so that we can take somebody that's bending to one side and we can start to pull them back and train the body, kind of like braces and teeth. We train the muscles to hold that correction so the person gets better and they don't go right back out, in a week. So it's a different type of approach that we do with patients. We have home rehab that patients do. So it's very active in our office. If you're a patient in the office, you are helping yourself get stronger and better every single week. And that's why I can't think that separates us from other practices. So if that's what you're into, if you really want to look for a solution to help you with your day-to-day health, your day-to-day posture, look for us. We're going to be a great fit for you. We'll walk you through our whole process, but make sure and click on that link there and schedule an appointment to come in and we'll take great care of you. So I'm Dr. Aaron Wall, and check out our other posture videos.